What is a common approach to testing for tick-borne infections? I focus on the most common infections I see in my practice. I order Lyme disease tests as well as tests for infections like Ehrlichia, anaplasmosis, and Babesia. I don't typically order mycoplasma or chlamydia unless there is evidence that there's active infections. I ordered an ELISA test, which is also called a Lyme titer. These are the tests where you need 2 out of 3 IgM bands. You need 5 out of 10 IgG bands to be called positive by the CDC criteria. These are bands that were identified in 1994 at a consensus meeting in Dearborn, Michigan. These markers are proteins that have been identified in Lyme disease infections. For example, the 41 kDa band represents a protein contained in the tail of a spirochete. I have not been ordering a C6 peptide or a VSLE protein test for Lyme disease. None of these tests for Lyme disease are all that sensitive in my experience. I have often had to use clinical judgment to diagnose and treat Lyme disease. I also order IgG and IgM tests for co-infections with Babesia, Bartonella, anaplasmosis, and Ehrlichia. I have not found PCR tests for these co-infections as helpful as I would like. I have found a blood smear for Babesia not that helpful if a patient has been sick more than 2 weeks. Some doctors have assumed Bartonella tests have been positive due to exposure to fecal matter from mites living on cats. I can't be sure the cause of positive tests for Bartonella in patients with Lyme disease. I don't typically order labs for infections such as tularemia or brucellosis, despite concerns by some of my colleagues. I have found treatment for Lyme disease would take care of these infections if they were present. I typically do not send bloods to a specialty lab if someone's on a budget. I also do not send bloods to these labs if I'm going to treat them clinically. I also order extensive testing to rule out other illnesses like a CBC, comprehensive metabolic profile, ANA, RA, thyroid, double-stranded DNA, sed rate, vitamin B12 and D. I may order a free T4 and free T3 if I'm considering a thyroid condition. I have found the ANA frustrating as most of the ANA tests are false positive. A positive double-stranded DNA supports the diagnosis of lupus. My patients don't typically have 3 other conditions that would support the diagnosis of lupus. I refer my patients to see a rheumatologist if there is a need to rule out lupus. I typically order a blood test for a tick-borne illness 4 to 6 weeks after the onset of the illness to increase the chances that I might get a positive test. I have had to use clinical judgment to treat a tick-borne illness if my patient is sick for less than 4 weeks or if I suspect a false negative test.